Thank you. Thank you. Thank you.
Good afternoon, everyone. My name is David, and I want to welcome you to the A12 Active 50 Plus Expo. Our speaker today is Dr. Raj Singh. He is an internist and nephrologist who specializes in health wellness, hormone balancing, medical weight loss, and anti-aging therapies. He is an assistant professor of medicine at the UNLV School of Medicine and faculty at Empire Medical Training. Dr. Singh has received several top doctor awards, has appeared on radio shows, and is considered an expert in wellness and anti-aging circles. Let's give him a warm welcome.
Thank you. Thank you. Thank you. All right, okay. Whew. Well, thanks to everyone for coming. So we'll get started. I hope everyone's able to hear me back. We're good? Okay. So I have this extreme inability to stand at one place and talk. I'll be walking around, right? And I also like my talks to be very interactive. So you don't have to wait till the very end to ask a question. If there's a question, please feel free to ask. And this is like a short 30-minute version of my about full day talk that I generally do when I'm training other doctors or other health professionals. So we'll get started. Okay, so the topic today is how to reverse aging. When we all want to do that, right? So we already covered this a little bit. So that's me. So I'm an internist, I'm a nephrologist. I teach anti-aging wellness, and I practice here in Las Vegas. We have a medical practice and a medical spa as well. So when we're talking about aging, we know it's progressive, right? So we all know what's going to happen to us in 10 years or 15 years, or I know I'm going to lose some more hair, develop some more fine lines, right? So it's progressive and it's predictable. So those are the two important things. If we don't make some changes, then we cannot stick with that pattern. One of the key things that happen when we age is we lose height. So as you can see from that scale, there is a reduction in height as we age, right? So now different organs age at a different rate. So my liver, kidney, hair, our knees, bone marrow, everything ages at a different rate. Lungs age at a different rate. Now if someone is a smoker, of course, or someone who drinks alcohol, you can accelerate the aging of that particular organ much more quickly than anything else. So these are some of the things that change. And so what happens? So well, we have a decrease in sleep, right? So as we get older, we sleep much more lightly. We get up several times at night. There is a decreased desire and for sex, right? So we lose our height, we lose scalp hair. There is also a reduction of muscle mass. Now, there are a lot of micronutrients that we get from our diet. So even if we are consuming them in proper quantities, we are not absorbing them. So the absorption of nutrients, especially micronutrients, goes down with age. Our body makes a lot of vitamins. A lot of vitamins are synthesized in our fat, like vitamin A, D, E, and K. They all are synthesized in our fat. So those hormones, those vitamins, the production kind of goes down as well. And of course, there's a reduction in the liver mass. There is a reduction in the number of cells that are in the kidney. We are all born with about 1 million cells in each kidney. So with age, number goes down. So typically around age 55 and above, we start losing about 1% of kidney function every 2 years. Then of course the bone marrow mass. So our bone marrow is very cellular when we are born, but over time it gets replaced with fat. So we have less cells that make white blood cell counts, white blood cells that fight, of course, infection. We have less hemoglobin, we have less platelets, so we have increased tendency to bleed. So no wonder as we get older, we get more infections, right? So we have more tendency to be anemic. And of course, we have issues with hormones when it comes to women. You can experience hot flashes. So now we all been kind of trained to believe that hot flashes are a normal part of aging, which they are not. So why do hot flashes happen? And nature is very remarkable. So nature has built a backup for pretty much everything. So for women, most of the hormones are produced by the ovary till about age 50. After age 50, the adrenal glands kind of take over. So if someone's adrenal glands are healthy and they're producing the same estrogen, progesterone, testosterone, and everything else, there is no reason for someone to get those hot flashes. But we kind of expect them to say like, yeah, that's just part of the aging process. It's not. So going through really, really bad hot flashes for women would be a sign that the overall health is not very good. And of course, we have decrease in bone density, we get more osteoporosis, osteopenia, so increased risk of fractures. I mean, how many times it happens? We're carrying some big grocery bags and suddenly there's a fracture on the wrist, right? And that happens despite us being in United States, where we have very high calcium diet and we have a very high vitamin D intake. So despite that, we have a very high rate of osteoporosis and bone fractures. So something is not right. And of course, unfortunately, as we lose our height, certain things actually increase in size, the ones that we don't want, right? So our noses get bigger, right? And our ears get a little bit bigger. We lose the hair on our scalp, but they grow everywhere else, right? So in our ears, of course, nose, and on the back, we have a redistribution of fat. So fat appears in weird places where we don't want them. And of course, we have an increase in certain hormones as well. This is not necessarily produced by the body. These are more what we call conversion within the body. So certain enzymes are activated. So a testosterone in a male could be getting converted to estrogen, which is more female dominant hormone. And that's what makes men more moody, more emotional. We cry more easy when that happens. Okay. So of course, the same thing. So we have reduction in body temperature. So we feel more cold. This is part of the reason because we have less blood going through our skin, right? So this is the reason we don't blush when we get old, even if we're very embarrassed, because there's less blood going to our cheekbones, right? So the density of blood vessels in the skin kind of goes down. We don't sleep as well, right? So, and most of the hormones, especially growth hormones, are actually produced while we sleep. So as we lose our sleep, we are making less growth hormones. So because of that, our ability to recover, repair our body goes down, right? And then of course, cortisol. So this is a key one. So cortisol is kind of like what gives us energy. When I get up in the morning, my cortisol level is supposed to be really high, around 7 o'clock. I wake up, I don't need a cup of coffee, I'm ready for my day. Then throughout the day, I should have plenty of energy to carry on till about the evening. And then at night, the cortisol levels drop and I'm able to have a more restful sleep. Now, when that pattern is disrupted, I wake up in the morning. If my cortisol levels are not optimal, I will not be able to open my eyes. I'll be looking for the light switch. I'll be looking for my cup of coffee. When that happens, I'll be able to drink my cup of coffee and I'll feel better for the next 2-3 hours. But then I'll need another 5-hour energy shot or something else, or a monster or something. So what those things do is they increase our cortisol level and we feel better. We feel good. Anytime sugar does the same thing. So we manage our day throughout by consuming these stimulants. It could be coffee, sugar. So now the time comes for evening when we should still have some energy, but because we've overutilized our cortisol, we have no energy left. Towards the evening, we should be going for a walk, but we have no motivation to go for a walk. And then comes nighttime when we should have a restful sleep, but that doesn't happen. We are in our bed and we say, everything hurts, everything aches, I just want to go to sleep. But my mind is in like a million places and we can't sleep. So that's because your cortisol levels are messed up. Now, if you stay past 10 p.m., that's when we get a second spike of cortisol. And if you stay past 10, you'll be able to stay up till about 1 a.m. and we'll have a lot of focus on the early morning hours. And then you can go back to sleep at 1. So those things happen because the cortisol levels are kind of messed up. And the reason they get messed up is because we overutilize our adrenal glands. We are all living longer, right? So go back 500 years, we'll be dying by the time we're in our 30s, 40s. So we're living longer, but our glands are not able to keep up with our demands. And there are just too many demands on our glands, right? Before it used to be, okay, I gotta get up, get my meal, get chased by a tiger, fine, everything is fine. My cortisol level will go up, the fear goes away, it'll go down, and I'm happy. So now I wake up in the morning, I have to drive to work, so there's a ton of traffic, so that's stressful. We're dealing with finances, credit cards, insurance companies, relationships. So we are dealing with a lot of different things, right? Plus we may have some negative people in our life, right? We call those energy vampires. So they're sucking away our positive energy, right? So like Susan, right? So Susan has a lot of problems. We try to help Susan, but her problems will never get better because she's the reason for most of her own problems. But what that does, it depletes our own positive energy that is basically your cortisol level, right? And of course, testosterone levels decline with age for men and for women. So we have decreased erections, of course, we have decreased ability to have sex. Orgasms are difficult, so all those happens from testosterone. Also, men tend to be more emotional as they age. It's because estrogen, which is a more female-dominant hormone, becomes more powerful as the testosterone declines. So a woman typically has fat storage around the breast area and around the pelvic area. So when you see a male who has a lot of fat in the pelvis area and chest area, that tells you that estrogen is the main dominant hormone working in that guy. That's not normal. But when the testosterone levels are low, so men, we are not happy. We are more emotional. We tend to have fat around the breast area, right? We tend to cry for no reason. We are more dramatic now than we used to be. And that's not a good feeling, right? And the same thing with women. When they have high levels of estrogen, they are also more emotional. They are moody. So they'll say I'll get away from me. And then in 5 minutes, they'll say, I love you, come back to me, right? So those emotional swings and spikes, they happen when our levels are messed up. So estrogen levels kind of go decline in most of us, but now the levels are kind of on the way up, and we'll see why estrogen is becoming a big problem as we get older. So this is typically what happens when we age. So if I have something that happens to me, right, which happened, so a month ago or so, I was in a car accident, it wasn't too bad. But because I have good reserves, I eat well, I'm happy, so I was able to recover very quickly from it. But as I age, my resources are going to be declined. And if I don't rebuild my body, then let's say I get a bad pneumonia, get a bad heart attack, I'll go to the hospital, and then I probably won't leave the hospital. Or I will have recurrent admissions to the hospital because I don't have enough reserves in my body. Those reserves are a good balance of nutrients, a good balance of hormones, a good overall health. If that's not there, I will not recover very well. And this is what we see is seniors getting admitted in a hospital, then from a rehab, then nursing home, then home, and then back to the hospital. In and out, in and out, in and out, in and out, and eventually we die. So we need to work on improving our reserves so we have more defense against those infections and all those stresses we talked about. And of course, we have to reduce the culture of pills, right? So we as a society has given too much faith to taking pills. Okay, I'm sad I need a pill. I can't go and talk to that girl and ask her out because I have anxiety about it. So I have social anxiety disorder. I need a pill for that. So we have somehow given too much power to pills. So pills are part of the problem. So we need to work on reducing the pill culture and actually helping our own body get better without relying on too many prescriptions, right? This is one of the big problems we see comes from our diet. So everything we eat has changed over the last 50 so years. So you can see how the chickens used to be. How the hell they got there, right? It's from feeding them too much corn, giving them antibiotics, tons of hormones, all of that stuff. So the protein, the muscle content in the chicken has gone down way too much, and it's all just fat now. Right? I mean, look at the cow. I mean, it's not we made a cow a super cow. Now all they do is just milk. How do you think that happens? It's all from the growth hormones that are injected. And I don't care if it says on the milk bottle, we pledge not to use the growth hormones. A pledge means nothing. What will happen if I break my pledge? Am I going to lose my license? Will I lose my dairy farm? Nothing. right? And how many times we hear these big corporates will make pledges that we know mean nothing. So be aware of where your food comes from, because getting a lot of hormones is a lot of problems. When we get hormones from outside, it's a signal to the body that I'm getting enough doses of hormones, so I don't need to make any. So if you're getting growth hormone that's injected in the milk to the cows and you're getting that growth hormone, your body feels, I don't need to make any growth hormone. I got plenty coming from outside. So it stops making what it's supposed to, right? So your glands kind of stop working. And then look at that. So what that is a pregnant horse, or what we call mares, and its urine is being collected. So all the birth control pills, all the hormonal IUDs, everything comes from pregnant. The estrogen comes from pregnant horses or mares. So horse estrogen is not our estrogen. It used to be back in the 50s, but then it was too expensive to ask pregnant women to give their urine. So they said, well, horses are cheap, so we'll switch to horses. So if you've ever been exposed to like an oral contraceptive or a synthetic estrogen, the effect stays for a very, very long time. And people go through more hot flashes, more depression, more anxiety, more heart disease, more bone fractures if they've been ever exposed to estrogens in their lives, in birth control pills, right? Or synthetic estrogens. So we need to be aware of those. And the progesterone, of course, synthetic progesterone comes from crude oil, causes a lot of inflammation. So these hormones are not our own hormones. Our own hormones are very mild, they're very gentle. Right? I'm not a horse, I shouldn't be getting horse hormones. Horse hormones are like 100 times more potent than my own. So when I get those, everything gets smaller. So the testes become smaller, the adrenal glands become smaller, everything. So a typical example, if you were to, somebody who started on insulin because they're a diabetic, if they started on 10 units of insulin today, do you think they're going to stay on 10 units of insulin in 6 months? No, they'll need 20. Next year they'll need 40. Then they'll need a second type of insulin, and they'll need something else. So what's going on is, one, as you're giving insulin, your body's developing a resistance to that. So you're going to need higher and higher doses. Same thing with thyroid. We give thyroid medications, you need higher and higher doses. So that's not the answer. Okay. So this is the problem we feel today, right? I mean, why are patients frustrated? Well, the doctors don't listen. Doctors don't have time. I got to click 50 buttons before I can get paid, right? So if I provide great care, I make less money because I had to spend more time. But the patient's frustrated. Doctor don't listen to my complaints. If somebody comes to me, hey, I'm tired all the time, I'll say, I don't know what to do with you, right? Or everything hurts, I don't know what to do with you. Oh, I cry sometimes. Oh, you probably have anxiety. Here is a Xanax. Okay, or I'm sad. Well, you're probably depressed. So here's an antidepressant. So that's what we've been trained to do, and I can. So anytime I'll prescribe you something, I'll say, I'm going to give you this, but you know, you might die from a heart attack because of this, or you might get an ulcer, right? Or you may not have sex ever again, right? So there are so many different things, right? So why is it that whenever we prescribe something, we have to say, well, I'm going to fix one problem, I'll cause 2 others, and now you'll have headaches, so let me give you a prescription for a headache, right? So this is what it is. We start you an antidepressant, the sex drive goes down, well, maybe you need hormones now, or maybe you need that Viagra. No. Right? So we start a medication, it causes some side effects, then we treat the side effects with another medication, that another medication causes more side effects, and long and behold, you're on 20 pills. And some of them you don't even know why they're for. So that's my first thing when we see a patient, I'll say, why are you on this medication? Oh, I don't remember. Well, then it's probably not important. Let's stop it. Right? And I'll be honest with you, I'm not saying you go home and stop all your medications, but I'm saying you need to question why somebody's on. I'll give a common example, Nexium or Protonix. These meds are supposed to be given, the heartburn medications. They're supposed to be used for 3 months. That's the maximum duration. Unless somebody has gone down your stomach and see there is a big ulcer, then you need to be on it for life. But everybody stays on it because nobody forgets, nobody bothers to stop those medications. You just go, well, here's 6 more refills. See back, right? So we just keep refilling the same medications that should have been stopped years and years ago. So that's a problem because we don't have time. We don't have time because but we need to fix those chronic problems. So this is a problem with our healthcare system, right? So I'm going to be given a drug and I'm going to be told, okay, this is a medication to lower cholesterol and it will lower everyone's cholesterol in this room. And that's good because I'm treating everybody like sheep, right? But we are not sheep. We are unique individuals. Human DNA is very complex. Our chemistry is very complex. Our DNA is all messed up, right? So a lot of mixing, right? So it's not so things have changed. Things have changed. So if I were to say, your cholesterol is high, you're going to take this medication, that's not the right way to manage it. Because we are all not the same. We are all different. So but right now, this is how we treat everybody. Everyone comes with high cholesterol, they get a prescription for Lipitor, right? So before we used to say, well, if you have diabetes, you got this. Just to prevent a heart attack, take an aspirin. Now last year we say, that actually was really wrong, that we've been telling you for the last 20 years. Please don't take an aspirin unless you had a heart attack. Because we know the side effects of aspirin, right? So things have changed. Same thing for insulin. Why is every patient who is a diabetic needs to be on insulin? What we need to do is, why do they need insulin? Why is the glucose not getting inside the cells? That's what I need to. We'll say, well, you have insulin resistance, that's why I'm giving you insulin. Well, if I have insulin resistance, why am I getting more insulin? Shouldn't I be getting medication to decrease that insulin resistance? Because if I give myself more insulin, the insulin resistance is going to go up. So that means I'll start on 50 units of insulin today, tomorrow it'll be 100 next year, right? Things change. Same thing for the thyroid. Anybody is on levothyroxine? Synthyroid this? Why is that the only answer? There are other things we can do, right? So it could be iodine, could be something else going on. Maybe you have something in your diet that is blocking that thyroid hormone. If you eat a lot of cabbage, you will have hypothyroidism. Cabbage blocks thyroid hormone. If you have a very high estrogen levels, it will block your thyroid hormone. So instead of fixing and looking at those things, we end up giving you thyroid medications. And now your own gland says, well, thyroid hormone is coming from outside, I don't need to make any, so your own thyroid gland will shrink over time. So you will need higher and higher doses of the same medication, right? So we'll start at 25 microgram today, next will be 50, then 100, so stuff keeps going up. And so the future of medicine is actually precision medicine. So I'm not going to treat everyone in this room the same. I'm going to treat every person individually because we're all kind of unique individuals, right? All right, so let me take a sip. Okay, so the first step is how to reverse aging is to actually measure aging. So I'm 40 years old now. So if I were to do a telomere testing, so telomeres are these caps on the DNA. Every time my DNA is damaged from free radicals, antioxidants, stress, everything, it gets shorter. So if I can measure the length of the telomeres, I can say, okay, I'm 40 years old now, my telomeres are only 30 years old. So that's really good. My cellular age is only 30, although I'm 40 years old. So that's a good thing. But at the same time, if you're 60 years old and your telomeres come at that, hey, you're 70, that's bad. Right? So that means your cells are aging much more quickly than actually your biological age. So at least there are a lot of other ways we can measure aging, but at least we got one where we can measure something, right? So now, of course, once you get the telomere testing, there are pills that you can take, which is nonsense. There is no, again, pill culture. Just because my telomeres are shortened doesn't mean I need to take a telomere pill. I need to see what I need, why are the telomeres short to begin with. If it is micronutrient problems, if it is stress, if it's hormones. So don't run to start taking a pill for everything. That's the exact opposite of what we want to do. Right? Fix the underlying problem, not rely on pills too much. Of course, these are a lot of micronutrients that are involved in our health. So you can see there are some vitamins, there are some minerals, antioxidants, glutathione, it's on everywhere these days, overrated. There are a lot of other important things. So old days we used to say, you are what you eat, right? If you eat good food, you're going to be healthy, but that's not true. Now we know that you are what you absorb. So you might be having the best food in the world, you're eating organic all the time, spending crazy amount of money on whole foods, but you're not getting, your vitamin levels are still low because probably you're not absorbing any. So it's what you absorb, not what you necessarily eat. And a lot of organic food actually is very nutritionally deficient. We know that because most of the organic food comes from new commercial farms that weren't organic a couple of years back. So all they did is remove the 16 inches of topsoil, replace it with organic soil, and now they got organic certification. But that soil is very nutritionally poor because that was just used for a commercial farming for the last 50 years. So most of the organic food is very nutritionally low. It's actually worse than regular food, but so it's more important to take micronutrients. And of course, avoid fads. Everything you see on TV is not true, right? So you can relate to this. So the way the fads work is, so if I have a lot of money sitting in my bank, I don't know what to do with it, and I will say, what is that useless vegetable that nobody eats? Okay, I can think of one. Okay, so what we're going to do is we're going to spend like $10 million or $20 million promoting that. And suddenly, out of nowhere, overnight, that'll appear on every TV show, every health blog. Everyone is talking about it. And now you're spending like 20 times more money than it used to cost before nobody knew about it. And then a year later, nobody's talking about it because that was just nonsense. So how many things come and go, right? How many things come and go? So avoid things those are called fads, right? So it used to be, eat grapefruit, then eat wheatgrass, then everyone is crazy about quinoa, then everyone is putting kale in everything they eat, right? Then cabbage, then soybeans are back, then wheatgrass. It's just crazy. So there's just tons of stuff, but that's all nonsense. So if something cannot even last 1 year, that's a fad. And if something is coming at you right away, everyone is talking about the same thing, all the way from Dr. Oz to your local health blog. There is a lot of promotion going behind it. There's a lot of money, and because there's not going to be any benefit from it, suddenly people are going to say, why the hell I'm spending so much money on this useless vegetable that I don't even like, right? So everyone stops eating it, and now they'll pick up another useless vegetable to market, and then we'll have something else to talk about, right? So avoid fads. They're not good. So same thing, if you have a reason to be on a gluten-free diet, please be. Otherwise, don't. Juicing is everywhere. That's one of the worst things we do for our health. We remove all the pulp, all the fiber. Juices is like drinking a soda. Causes a ton of insulin spike, causes insulin resistance. So that's the worst thing you can do for your health. Eat raw fruit. Eat 10 oranges if you have to. It'll take you some time, and that's what you need to do. But when we drink a glass of juice, within 30 seconds, you have a big insulin spike. That's really bad for you. Don't do juicing, please. This is another thing we encounter. These are called xenoestrogens. This is probably one of the most important things that's causing accelerated aging. So xenoestrogens are these chemicals or endocrine disruptors. So they act like they are our own estrogen, but they're not. They trick our body into thinking that estrogen levels are high, and all our tissues perceive them that estrogen levels are high. So when we have a xenoestrogens, they kind of act like estrogen. That's a female hormone. They are in our plastics. So BPA is a common example. They used to be in non-stick cookware. Anytime you heat, styrofoam, eat coffee from a styrofoam cup, it's really hard. You're getting estrogen. So what that does is, so if I'm a male, so my testosterone level is super good, and I start drinking, tons of, hot coffee from styrofoam or thermal paper, or handling BPA, or my non-stick cookware is really old and it's all scratched up. So all that harmful chemicals are now in my body, and I'm not used to having that much estrogen. So what that does is it makes me fat. So I'll have more fat storage. It makes me depressed. It makes me more moody. It's kind of a woman going through PMS, close to their menstrual cycle. We don't like it as men. And same thing for women. If they already have, so that's the one reason, even I have patients who are in the 50s and 60s, the estrogen level should be really, really low. But they have symptoms of very high levels of estrogen. We call it estrogen dominance. This is where estrogen is acting as a dominant hormone. Makes us moody, emotional, ankles are swollen, our stomach is bloating, everywhere you press, everything hurts, generalized body things that nobody can explain why you're having all those weird symptoms that comes from xenoestrogens. So plastic bottles. So the reason I have an alligator there is because they compared alligator in two lakes. One was basically very far away in remote places, very healthy. The other was close to an animal farm. They tracked these alligators for 10 years. The ones close to the farm where the cows were injected with hormones, of course, the hormones were cow urine, and the urine was making it up to the lake. So these male alligators basically had reduction in muscle mass, reduction in penis size, reduction in sperm count, everything. So these male alligators were turning more female. So that's what's going on to all of us. So especially all men are under attack because of xenoestrogens. You will see that the adoption rates in Missouri, Kansas, Midwest are very, very high. Although it looks beautiful and it's green, it's because the sperm counts are really low in that area because everything is so toxic. Pesticides, insecticides, all the wheat belt. When these men move from the Midwest to even a highly polluted city like LA, the sperm counts actually recover. So just because it looks green and doesn't mean that it's a healthy place to be, right? So xenoestrogens, look it up, and there's a big list of probably like hundreds and hundreds of chemicals. But the big ones are plastic bottles, especially water bottles, and non-stick cookware. And anytime you eat food from a canned food, the cans are lined with plastic that has a lot of estrogen, so avoid those. Don't heat food in a plastic container in a microwave. That causes the estrogens to leak into the food. Those are some of the simple things you can do. Avoid air fresheners. A lot of estrogens. Okay, so I guess we're coming more towards our end of our talk. So here is how we look younger, right? So this is some of the things that I do on my skin, right? So you can get facials, you can do microneedling. I'm not going to go into detail, but this is some of the treatments that we offer. Fibroblast therapy, again, kind of help the skin tightening. And of course, a good skincare product. So these are some of the things that make us look younger. And these are things that we can actually do to feel younger. So the first one is, stress reduction and cortisol, right? So we need to see where your adrenal glands are. Are they healthy? If they're not, we need to rebuild your adrenal glands, and we can do that, okay? And of course, avoid spending cortisol on people that are not important to you. So avoid negative people at all cost, if you can, right? So that is very, very important. So keep your energy. Of course, have a balanced diet. As the less animals you can add in your diet, the healthier you will be. Not necessarily because the red meat is bad, it's because all the hormones are. We have no control of what they're feeding us in the buffets here or in the restaurants outside. So avoid plants, always tend to be better. So have a more balanced diet, less animal, more plant-based. And of course, get your micronutrients tested and see where the levels are and optimize the levels of your micronutrients. There's no need to get a useless blood test, same blood test that you're getting from your primary doctor every 3 months. Nothing is going to show up there. You've been getting the same test for the last 15 years. There's no need to do the same renal panel, chemistry panel, CBC. It was fine the last 3 months. Why is it going to change now? But instead get proper testing, which actually is measuring something that you can actually do something about, right? And of course, there's detoxification. If you have exposure to a lot of fish, if you eat a lot of seafood, a lot of mercury exposure, if you drink water from a well. So there are a lot of different ways you can get toxins, heavy metals, so we can talk about detoxification and do those things. And of course, balancing your hormones. So if you're male, you get your hormone panel and your testosterone is low, estrogen is high, that's a problem. We need to work towards how we can regulate it and make it where it's supposed to be, right? And same thing for females. If you're 60 years old, there's no need to be having very high levels of estrogen. Estrogen is supposed to generate development of breast tissue and store fat in the pelvis, but that's supposed to be when you're going through puberty. Once somebody is pregnant and given birth, there's no need for estrogen. So there's no need for estrogens to be very high in someone who's in the 50s. So if that's high, we need to optimize it. And of course, rare cases, we'll have to do hormone replacement. That comes with bioidentical hormones. These are more plant-based. Some creams and all we can use in case your body is so bad that it cannot make its own hormones. Yes, sir?
What's your definition of reversing aging?
What's my definition? My definition, like I said, we have only one way of measuring aging, the test that's available commercially, that's the telomere testing. So if I do my testing today and my telomeres are at 40, I make the necessary changes, and a year later I repeat the same testing and my telomeres showing its age as 38, that's a good thing. So I have reversed aging and I have a test to prove it. But aging otherwise...
Aging in itself, to reverse it means you're going to get younger.
Correct. So when we're talking about reversing aging, you're looking at looking younger, right? So you're looking at skin treatments that makes you look younger from the outside. So those are all Botox fillers. But at the same time, how you gonna? There's no point of looking like $1 million from the outside, but feeling like really old on the inside. I want to feel good as well. I want to get up in the morning. I want to have tons of energy throughout the day without relying on coffee, sugar. I want to exercise. I want to enjoy my life. I want to be able to do the same things I used to do when I was young.
At 3 there, where's the reverse aging coming?
That's what we're all talking about. The whole thing. So, and of course, restful sleep. So our neurotransmitters, they get disrupted with time. So we go through different stages of sleep when we are sleeping. All our hormones, especially growth hormones and certain other neurotransmitters, are synthesized in our sleep. So if your sleep is no good, that doesn't mean that you need to take an Ambien or Lunesta. All that does is it just makes you have the sensation that you're asleep, but when you're really not. So you wake up in the morning because it does not get you to all the stages that like this way it's supposed to. So when you go through those stages, you wake up in the morning, the sleep has not been very restful. Most of the nightmares and night terrors happen in N2 stage. That's where these medications keep us. So you wake up in the morning, you feel like you were being chased by monsters. So that's why it's not a good idea to take a sleeping pill. It's more important to see, why cannot you sleep well? Why is your body not, when we close our eyes, that's a signal to my brain that I'm ready to go to sleep. So we have delta waves and theta waves. So as soon as I close my eyes, a lot of things happening, a lot of signaling goes on in my brain to put me to sleep. If that's not going on, there might be issues with your neurotransmitter levels, and we can measure those. And if you can't fix your sleep, you can't fix your health, because everything gets synthesized there. Give me a couple of minutes, we're almost about done. Then I'll answer your questions.
Your age, birthdays, you're just reversing how you feel.
Well, age, as I said, if my birth certificate says I'm born in 79, I cannot change it. But if I'm 40 years old right now, and if I'm feeling like I'm 30 years old and I look 30, and people tell me, what do you do? How you have so much energy throughout the day? To me, that is reversal of aging, right? Well, everybody who's in my same age group asks me, how the hell you manage multiple jobs, traveling all over the world, giving engagements, yet still have time to do workout, go to a dance class, do all those things. So that to me is reverse aging. That's what we're talking about here. Look good from the outside, but also feel good on the inside. There's no point getting a Botox and have a frozen face if I don't feel well. What's the point of that? Right? I want to do both. Right? I want to look good on the outside, but I want to feel good on the inside too. Right? If my mood is not great, if I'm I'm a negative person, right? People don't want to talk to me because my mood is so messed up. What's the point of looking great on the outside? Everyone is going to avoid me anyway. So I want to look where I have a great mood. I'm happy all the time. Then people want to kind of be close to you, right? So moving along. So of course, like we were saying, avoid bottled water. RO systems are the best because bottled water is not regulated. So you don't really know which tap the water is coming from, right? So plus plastic bottles have a lot of BPAs, a lot of xenoestrogens, especially if a plastic bottle has water sitting in a hot climate, right? In the middle of the truck, in a warehouse, you don't want that. And of course, if you put a lot of sunscreen on, always stick with metal-based sunscreens, because anytime we use chemicals, they get absorbed. Anytime you apply a cream, it can be more toxic than a pill, because when we apply creams, they get directly into our bloodstream. They get to lymphatics, they are in our tissues. But when we swallow something, it goes to the liver and can get detoxified. So pills can be less toxic, but a cream or topical exposure can be more toxic than actually swallowing a pill. So always remember that. So what we apply on the cream, we don't say, oh, it's just a cream, what the hell is it gonna do? That actually causes more damage, okay? And then of course, that's a hard one to read. But of course, make sure you have organic products, but make sure you're taking some micronutrients with it. And then of course, don't heat plastic. Use cast iron utensils as much as possible, so you are not removing that coating of xenoestrogens. Avoid food in tin cans, we kind of covered that. Avoid fabric softeners when you're doing your laundry. Again, a lot of estrogens, a lot of xenoestrogens. Avoid a ton of detergents. Avoid the crazy air fresheners everywhere. Maybe get some essential oils. Maybe light a candle. Those aerosols, they cause a lot of damage to our health. Reduce animal products, and of course avoid things like when it comes to salt, there's a lot of different things. They'll say do Himalayan salt, do this salt, do pure sea salt. Those are all good, but remember, pure sea salt has a lot of trace minerals, so it's good for us. But at the same time, things have changed now. Our oceans are really polluted. So if all you're doing is a pure sea salt, you're getting a crazy amount of lead, you're getting a crazy amount of mercury, and a lot of microplastics in that pure sea salt. So it's not worth the extra cost, plus the exposure to heavy metals is not worth it. Same thing when it comes to Himalayan salt. Yeah, it has a little bit more trace minerals, but it's 30 times more expensive, right? So I'd rather just take a regular salt, which I know does not have any heavy metals, which I know has some iodine, and I'd rather spend that $20 back. All right. If I can